Alexa, what's the stock market today? Oops.
The American stock market is up. 500.
Six, 7, 6. 6. Mhm.
Hello, everyone. Can everyone hear me, or can at least one person hear me? We got some, okay, got some waves. That's great. Thank you.
Yeah.
My name is Kayla Camelli. I am one of the product owners of the road system, currently the MOT system administrator as well. We're really excited to have y'all here today. It looks like about 75 folks signed up. Oh, you can see my dog walking in the background. Sorry about that. We had about 75 folks sign up today, and I see about 43 are here. So we'll get started. I want to respect everybody's time, and if folks come in, they'll miss the intro slide. So no meat just yet. So let me move on here. We'll get into our agenda. We'll meet our team. I didn't get to coordinate with my team. So if someone on our team can just manage the chat for me, that would be amazing, because I have too many things going on to do that right now. I mentioned my name is Kayla Camelli. That is an old photo of me with more exciting hair. I don't have it anymore. I am one of the roads product owners, and I'm currently our MOT system administrator. And I've been working very closely with someone whom I think you all know very well, Jody Kramer. I'm going to hand the microphone over to Jody so she can introduce herself.
Hey, good afternoon, everybody. Great to see so many familiar faces and names. So yeah, for those that don't know me, I'm Jody Kramer. I've been on the Compass team. We report to Gina Mason, and I have been since 2014 been assisting the providers that submit their data through electronic interchange, and also a lot of your EHR providers, your vendors and their contacts. And so, yes, as Kayla mentioned, I am as well a co-product owner with her. Couldn't ask for anybody better to be riding along with this project. So we're super excited to meet with you all today and to share some information.
Thanks, Jody. Gina, I didn't see if Gina's on the call. There she is.
Hi, good afternoon, everybody. I'm Gina Mason. I am the Compass Systems Manager, and I'm also the project director for the Roads project. And so I'm just here to help answer any questions in chat and just be here to support my team. Happy to have everybody here.
Thanks, Gina. And I didn't see Kim. So Kim, if you're on, speak now. But I don't think Kim's on, but Kim Howard is our project manager on this project. And it's been lovely to work with all of the people on this board that introduced themselves. So thank you for being a good team. All right, getting into our session objectives. First thing is, I know folks are excited to see the portal user interface. So we'll be able to give a brief demo of the portal. We want to be very clear that the portal is not done with its cosmetic adjustments yet. We're getting in, folks, we're still building some of the functionality components in there, putting up some plumbing and some electrical. So we haven't got to the paint and making it very pretty, but we wanted to show you what we have because we're excited about it. And we're excited that it's going to get used pretty soon. We'll understand project timelines. We'll go over the updates. We'll review EDI portal functionality and the new functionality benefits that EDI users will get in roads that they did not get in MOT. We'll review changes. So we made some field changes. We've also included a couple new data segments, which we're excited about, and then will be available during the course of this webinar, or if you have questions and you want to ask them afterwards, feel free. We really want to use this time to give you the information that you're looking for. So with that, I will keep us going here. We did team intros. I think the first thing we're going to talk about is new data segments. And I think, Jody, that was your cup of tea.
Yeah, definitely. So I know many of you have been anxiously awaiting the new roads EDI specifications documents, what we're calling version 2. And when those come out, which is right around the corner, we have some new data segments. And this was part of the postponement of our go live to April of 2024 was really trying to be mindful of the inclusion of as many things as we knew were out there and were on the immediate horizon versus, putting something out and then, 3 months later, we're like, oh, hey, here's some more. So what you will see in the new documents is we will be allowing for Measure 110 reporting to come in through the through your EDI files. Stabilization services, that's often called MHS 25. It is a program that is offered to a certain pocket of folks that may have a mobile crisis and they need some stabilization services as they get put into more of a permanent or long-term, kind of treatment. So that's going to be able to be reported through roads and EDI as well. Mobile crisis is going to be included. It will be a subcategory of the regular crisis because it's just kind of some appended additional fields. So that is being included in the new build out. Real D and SOGI. As many of you have talked to us over the years, wanting to know, can MOTS collect Real D and SOGI? Can we get more updated, gender, race, ethnicity fields? Because many of them are dated from when, MOTS started in 2013 or prior. So we've been working really hard to have RealD and SOGI included, and this will be those updated fields for consistency across the different values and things that can be picked for each of the fields. And additionally, you will be able to send a full RealD questionnaire and reporting on your clients to the road system through the EDI. And we also have added things that are called service elements. Now, service elements aren't necessarily a new data segment, as the prior four you'll see are actually a new segment that you can combine with your client profile details and certain things. But the service elements are something that really speak to a lot of our CMHPs. They're contracted, what we call service elements. And we're going to now have the ability for the CMHPs, as well as any of their subcontractors that need to help us identify what they're providing on behalf of the county, that will be able to be provided within the non-Medicaid services and within an episode of care. So with some start and stop dates and pretty exciting stuff there. So again, when the documents come out, you'll see these are new segments. And yeah, I think unless we have any questions on these, Kayla, I'll turn it back to you. And I'm sure we'll have more questions as we keep rolling forward.
Sounds good. Thanks, Jody. So we mentioned that there will be new functionality available for EDI portal users that was not available in MOTS. And we wanted to list out a couple of things that folks will be able to do that they weren't able to do in MOTS. So EDI portal users will be able to see their clients in the portal, and I'll be able to show you this when we demo the portal in a little bit. There, you will be able to make limited edits. And Jody, if you want to jump in, I can't remember exactly which fields we made editable for them. And folks will also be able to review their file submissions and the error messages for those files. So I'll make sure to review all of that once we get into the portal. I just wanted to list it out for folks so you can see it visually before I run through it in a demo.
Yeah, no, that's great. I could just speak quickly to the making limited edits. We typically don't have you make lots of edits through the portal because we want to keep your EHRs in alignment with the data that you're sending to MOTS. But we have had the ask of like, hey, we can't close this client. We've got a difficulty in either the process or, with the batching or however the files are picking it up. So we're adding a functionality where you will be able to do with the right permissions and roles for the individual at your organization. You'll be able to close those clients. There'll be a few fields that you'll be able to update when you do that. But I know that's been an ask for a long time. And then we're also making some of the other things that you reach out to MOTS support to make changes on, like last name at birth, date of birth, client ID, things like that. We are adding some flows and processes into the portal in the system to make that a little more streamlined as well. You may or may not have the ability to edit it, but we're definitely recognizing that a lot of emails and things going back and forth take up a lot of your time. So Kayla and the teams are working really hard to get these processes and flows in to make things much more streamlined and less redundant. So with that, Kayla, I'll turn it back to you.
Thank you, Jody. All right, we're going to get on to our MFA, and I'm not sure if folks are familiar with, I'm sure you're familiar with multi-factor authentication in your regular life, because I think it's something that most of us do now to log into all of our, various online accounts. But it will be required for roads. Right now, MOTS does not require any MFA to log in, although it is still maintained through Citrix, which is our state system, our state access security system. So all roads providers will need to configure MFA access to roads in order to access roads. There will be an app option. So if you have a smartphone, you'll be able to download an app that'll help you with this authentication process. We are investigating and trying to compile a couple different options to give folks to do this the first time, because there will need to be some coordination with us to get through the authentication process initially, because you have to notify the state that you are who you say you are, and you have access to the state before you can get access to this internal cyclical MFA process. But we're working with teams that have onboarded providers over last month. We're seeing what worked well for them, and we're getting a lot of helpful information from other state users that are onboarding providers. So we think we'll have a really good idea for what this is going to look like, and we're going to make it as painless as possible. And if you feel like you're interested in being a beta tester, or if you're willing to help us, I have reached out to a couple folks to see if they'd be willing to go through this process, because we know there are going to be some kinks in this process, because us internal folks aren't able to see what this looks like for people who haven't done it before. So we're needing folks on the outside, some of our external providers, to beta test the process for us and help us refine it. So before we send it out to 500 MOTS users, we will hopefully be able to catch those snags. So if that's something you're interested in, or you're willing to help us out, if you could just leave a note in the chat so we know who to email, that would be extremely helpful. I'll be putting this call to action out during all of these webinars, because we will need a handful of folks. But if that's something you could do, would be very, very grateful for your time there. But other than that, MFA is going to be great. We're going to get everybody through it. But now back on to roads field changes. Jody, did you want to talk about field changes?
Yeah,
you
sure.
see my dog in the background. I apologize. When I move my screen, it shows Joey.
Joey's either subliminally on the screen or in the background. So the joys a lot of us have with remote working and our counterparts, that's for sure. So field changes. We have spent quite a bit of time, Kayla and I, working with program staff here at OHA, as well as our Compass team has a group that is called the Tackling Administrative Burden. Maybe you hear the word TAB. So they're called the TAB team. And what they did is they went through all of the different programs that have you reporting, whether you're reporting to MOTS, maybe you're filling out a separate Word document that you have to send in on a certain cadence. Maybe you're, sending stuff to OHSU on behalf of certain programs. Possibly you're filling out other spreadsheets, all of those things that are kind of a little bit of a one-off from MOTS, and of course the MOTS data as well. We wanted to make sure that we weren't asking for information that wasn't being utilized or that wasn't relevant anymore, or maybe needed to be updated to more current language or requirements. So during this course, we did have some fields that have been added. This is not an exhaustive list. This is just a small pocket of the ones that have been added. Because as you can imagine, with adding the new data segments for Measure 110 and for stabilization, services, mobile crisis, RealD, and SOGI, there's quite a few fields there. But this gives you a little bit of an idea of some of them that we did add. We'd heard for many years the fact that we did not have a discharge date that you or your EHR system was able to populate. And that was a little bit more of a calculated based on when it's submitted currently with MOTS. So now there will be a discharge date in version 2. There'll also be a last seen date or last date of contact. There's also opportunity for suffixes, alias, social security numbers, of course, the service element and programs, which is a huge thing on the OHA side. Then we found some that we needed to remove. So the ones we removed is a little smaller than the ones we've added, but we wanted to make sure we took out things that were no longer needed according to our experts and subject matter folks in those areas. So as you can see, there's some here that have been taken off. And then we have some that have changed. So there's still, fields that we've collected before, but we have made some adjustments. So number of grades completed won't just be a numeric field. It's now going to be a more meaningful set of values and options to pick from. And that says drop down because, of course, if you're in the portal, if you're doing any data entry through the portal, we want to make sure that you can utilize meaningful drop downs. The also last date of substance use, it was had a different name. We've kind of changed that, so it's a date versus days. And then children, so kiddos that their parents are in residential treatment. We've had where you can send the date of birth for the clients, or the kiddos with the client, to let us know that they're there. We've added some start and stop dates, so to help define bed days. That was some of the outside reporting that was happening from outside of MOTS. So what I will say is the fields that are staying the same. So there's a lot of fields in MOTS that are staying and transitioning over into roads. Those we have not done a bunch of changes to, like the codes or the numeric values that are used to crosswalk. We tried to only make adjustments where it was necessary or where new things were being added. So you'll see more of that in our documentation, but we've tried to make some sense of what we're changing, why we're changing it, and best reason for doing so to hopefully minimize impact and a burden on everyone who will be migrating over to roads. Okay, Caitlin, I'm gonna hand it back to you. There you go.
Thanks, Jody.
Yeah.
All right. So for roads, we will be doing a phased rollout of the total product. We mentioned the last time we had a webinar, we were talking about how Roads was built on Microsoft Dynamics, which is a very dynamic platform. We'll be able to add functionality as the state grows, as Roads grows, because we anticipate Roads being the landing place for a lot of the data that comes into the behavioral health area or the behavioral health division. So the rollout that we have so far, and mind you, Roads will be something that continues to grow. So what we have so far is spring 2024 will go live with our data segments that Jody outlined. Measure 110, mobile crisis, stabilization services. Summer of 2024, we will be able to deliver some advanced or enhanced provider reporting. Right now, as many of you know, if you want your MOTS data in a report form, you have to send us an email, and one of our internal folks has to configure run the report and then send you the results. In Roads, that capability will exist inside the interface. So you'll be able to run a handful of pre-designed reports to get the data, and you can use that as you see fit. So that'll be totally provider driven, which is great. We're really excited to hand over some of this capability to providers. So there's no waiting, there's no requesting. It's just whenever you need it, you can access it. Additionally, in the summer next year, we will be able to get some administrative functionality into the system. So this is any of our MOTS admins will know kind of the process to add a new user, to remove a user, to add a facility, to change a data submission method. All of those requests happen outside of MOTS currently, right? That's an email. If you want a user, you have to fill out the form, our Microsoft form. But in roads, eventually by next summer, it will all be in the system. So it'll be a click of a button. The form will be within the interface, which we really think will help streamline this process. And if any of you have are working with agencies that are relatively new to MOTS or haven't been, or you remember the process of registering an agency in MOTS, you know there's a lot of back and forth with all the agreements that need to be signed, and there's just a lot of steps which are needed, right? We want to make sure that folks are accessing the system that have the correct credentials. But we're really excited to bring that administrative kind of operations work into the system, because we think it'll help providers know that they don't have to like get out of the system to send a separate email. It'll help us internally to track requests and be able to make changes speedy. So we're really excited for that. Well, as a MOTS system administrator, I'm very excited for that. And then fall of 2024, we will be attaching an assessment portal into roads. So this will be like the CANS assessment, and my acronym brain is not on yet, but it's a child, someone will know, child assessment, a standardized assessment that'll be in that portal. And then the drag and drop functionality will be accessible by fall of 2024. And for those of you who might not be familiar with this term, the last time we met about roads, we had talked about it a little bit, I think. The drag and drop functionality is essentially a midpoint between folks that are using EHRs or EMRs, but do not have any kind of configuration to send data to MOTS and or roads. So if your EHR is not compatible or doesn't have, I'm using all the wrong technical terms, I'm sure, Jody, I'm sorry.
No, you're
It's
doing
a place
great.
where if your EHR can configure an Excel document in a template that we've, okayed, then you can drag that Excel document or that table into our system and it'll ingest that data. And Jody, I can hand over the mic if you want to go into more detail with that.
Just real quick. So on that drag and drop, what it is, like Kayla mentioned, a great job. It's kind of a hybrid. So we know that there are a lot of EHRs and EMRs out there, and that some of them have not built out the full integration through EDI. And so there's been a large ask over the years of, can we have a business intelligence person, just fill out a spreadsheet that, per your instructions, or we've had these other smaller EHRs ask, is there a way we can just put it into an Excel, bring it out? And in the past, we haven't been able to do that, but this functionality will allow that. This functionality will be available for, in addition to normal behavioral health, SUD or co-occurring treatments, it'll be available for the other segments too. So for Measure 110, mobile crisis, stabilization services, Real D. So it's pretty exciting. It gives a lot of flexibility on what we can do there. And I'm not sure if we have another slide that'll cover it, but I did want to say that upon go live in spring of 2024, the road system will be ingesting MOTS legacy version 1 is what we're calling them, EDI files. So the files that your systems are currently generating and creating will be accepted upon go live. Additionally, any EHRs that have been able to build out parts of or all of the roads version 2 will also be able to be certified and accepted. There will be a certification process for version 2, just as there used to be with version 1. Also, on Go Live, all of your prior MOTS data and your facility setups and your data submission methods will have been transferred over to Roads. So for a lot of you, initially on Go Live, it may or may not be much of a difference depending on where your EHR is at. If they're still in development of your version 2, you may be doing version 1 for another month or 2. With that being said, once we get the documents out, we will start having more collaboration with probably the providers and their associated EHR that they belong to kind of talk about where they feel like their development is, kind of timelines, things like that. Because of course, we'd like to get the version 2 data as soon as possible, but we do understand as well that there's different cycles of time, development, training, a lot of things. So we intend and we anticipate working collaboratively with all of you. And I will say though that just realize that MOTS version 1 legacy files will be sunsetted at some point. So once we are able to get a holistic view of all of the different EHRs and providers and their IT teams, then leadership and whatnot will make a decision on when that sunsetted date is. So with that, Kayla, I think I covered what I wanted to.
Perfect. Thanks, Jody. All right, now we'll move on. Oh, this is still blurry. When I keep it small, it's not big enough. And when I make it bigger, it's too blurry. I apologize for that. This is just a brief outline of our updated roads project timeline. As you can see, we're in the beginning of November. We're just getting rolling on planning, implementation and training for providers and internal users. So I just had a couple meetings about that today. Trying to figure out what that cadence is going to look like, how it's going to be structured and organized, and how we're going to invite different groups of roads users at a time to do their training in the train environment. And then we'll have that in March. So anticipate some information coming to you early next year about trainings and when you can sign up for those. And then we'll go live in April, and then we'll have some, we'll stabilize the next couple of months, and then we'll be up and running with roads. We're very excited about that. And I think next is our user interface. So I'm going to stop sharing my screen real quick so no one has to see all of the tabs I have open on my computer while I get to the portal.
I did want to kind of, while you're doing that, Kayla, just kind of
Sure.
Put out there too. I know there was a question in the chat about will multi-factor authentication be required for the portal and SFTP? And it will only be for the portal. Your SFTP directories that you currently use today, whether your EHR sends them automatically or you or someone at your organization has that task and does that, those are going to stay the same between roads and MOTS. So you aren't going to have to configure anything new or getting any new access point to our servers. All of that will be the same. The only difference is when we get to that weekend, we will, roads will come in and give MOTS a break and start taking up all the files, giving you results files. So, all right, Kayla, looks good.
Thanks, Jody. All right. So this is our landing page for roads. This is going to be what you're looking at is our roads UAT environment. So none of the information in here is production environment. It's all test data that we've made up or that has been made up in the past. So you'll sign in if you have credentials. Anyone who has a P number has an account through Azure Active Directory. And that's how your MFA will work, is through that Azure account. And I'm getting my MFA right now. So give me 1 second. But this is what it looks like. This is good. Except it asks for your password so many times. All right, I'm in. All right, so once you're past the sign-in, you'll see these tabs at the top have changed. We have our client tab, our administration tab, which will get us to our facilities where we could manage our users, our facility information, our facility contacts. And then we also have an EDI tab now. So I'll start with clients really quickly, and I promise we will get to the EDI tab in a sec. So we are still working, like I mentioned, on some cosmetic adjustments to these pages. We know that we have the basics of what we need, but we can clean it up a little bit to make it a little more user-friendly. So right now, you can use any of these fields to search for a client. You can filter by different things in here. Filter by status. You can filter by client ID. All of it is there. So admin smoke, that's a fun one. You click on a client, you'll see a brief client summary at the top of the page. And then you'll have all the different segments that are available for that client. So depending on what data submission types your facility has been approved to submit, you'll see those segments in this section. So if your agency has nothing to do with involuntary service, you're not going to see this involuntary service section. So it will not be there to you, not be available to you to submit. So for a regular behavioral health assessment or that's ad assessment only, we're still working through some bugs in here. The UAT environment is not the one that is most up to date. So some of this stuff does not make sense when you're looking at it. But you'll see a client summary, you'll see a behavioral health detail with information in fields. Our diagnoses are in these subgrids. Our SUD section. We will be getting a couple more updated, I can't remember what these are called, this cookie thing up here that tells you where you are. We're going to get that to be a little bit more specific and show who the client is and what page you're on. So that's a client. If you're at a facility and you're an admin and you want to kind of manage your business or your users, you go in, click on the facility that you want to edit. And we have that because some folks are in charge of multiple facilities. So you'll be able to manage your facility users. You'd be able to delete a user if you have the right permissions. This is where we'll eventually have that request button. If you want to add a new user, we'll put it somewhere on this page that says, hey, you can add a new user right here, and then we'll go through that process. There's also our data submission methods, and we'll have a similar process here if you want to change one or if you've been approved to submit a data type that you have not been approved to in the past. So all of that will be a request-oriented process because many of those things require our internal team to do some work on the back end, right? If you have a new user, you have to tell us so that we can request a P number for them and get them set up with Active Directory. They'll need to sign into the system. So that's really the basics for a facility. We'll have our contacts. We have our facility IDs and our facility contracted with down here so folks can see their active contracts. That will be very helpful for us to track that information. And last but not least, our EDI tab. You will see the submitted status file. We can click on the status file. We'll see the summary information at the top, some HDR segments. And Jody, if you want to jump in here and provide a little bit more context for what we're looking at, feel free. If not, I can go through the file level errors and the transactions.
Yeah, no, you're doing great. We just wanted to give you all some eyes into the system to actually kind of be able to see what came in with your file, kind of how the processing went, the file level errors is I think one of the next tabs that Keela was going to click on. And so what those are, file level errors would be if the whole file had an issue. Those would be called out here, kind of let you know what those are. And then the ones the tab that says transactions would be the individual submissions within your file. And all of those transactions would be listed here. ones that were successful and ones that were not successful. And there will be information on those transaction details for the ones that had errors. And then we also put in, it's a little bit on, not all folks may use it, but the raw content, we wanted to put that in here because sometimes when we're helping you troubleshoot and we're kind of looking at things, if you have access to your file or maybe you don't, what was in your file will present here so we can granularly look at the transactions themselves per client, the errors holistically throughout the file, and then also at the file level itself if the whole file has an issue. So we're hoping that this is going to be a useful tool for all of you. You still will get your results files in the morning like you do now. Actually, you're going to get them sooner because we're increasing the frequency of the file processing. So it won't be just once every 24 hours. It will be multiple times throughout the day. Once we have that cadence finalized, we'll let everybody know. So that's exciting too, that it's not going to just be once a day. And then the other section, of course, that Kayla was showing on the clients, that the submissions and the things that were accepted for your clients, you'll be able to see your client in a pretty much a read-only fashion under the clients. But at least you're gonna be able to see, did it come in? What's it have? How's it reflected? You'll be able to see other things that you submitted for your client if they've had crisis events and stuff like that. So you'll have access to this, of course, in a more of a read-only format, but at least you've got some eyes. We have heard for years that you've kind of had some blinders. The portal wasn't quite as helpful as we'd hoped. So we're trying to make this one much more useful, and it's flexible. So we should be able to pivot and do adjustments and exciting things in the future too. Moving to this is on a Microsoft Dynamics platform. There was many reasons why MOTS was getting a facelift and new modern technology, but one of them is that flexibility to pivot and make things happen that are requested. So, as many of you know, MOTS has been froze for a few years, so we're super excited, especially like Mobile Crisis getting that in there is probably one of my exciting things that we've been wanting for a long time. So.
Thanks, Jody. I appreciate your expertise in that EDI tab because I've done less work in that tab. Folks will also be able to manage most of their own profile information if your phone number changes or your title changes. As far as agency facility changes, those won't be available to change. Is that something we'll have to confirm? But there will be a lot of flexibility in regards to how providers would like to see their information presented to them. So we're excited about that. But otherwise, that's kind of a brief portal demo. I will just remind everyone again that this is not the final product, that there are still plenty of changes that will be happening, buttons to appear, or navigation bars that will be there to help make navigating the system easier. But we did want to give folks a chance to see it, to make sure that it's there. And so that really we could show off what we've been working really hard on for the last year and a half, I think. Outside of that demo, we are open for questions. Does anybody have any questions that we did not answer in the chat? Or team, do we have any questions in the chat that we need to answer as a group here? I have not been monitoring that.
Well, there's a couple things that I think that was in the chat that might be useful. Let me find the original question. One of the questions was, will the status and service files on the SFTP need to be in a different format when we switch to roads? And the answer that I put there is that the file format is going to remain the same. We're just adding those additional data segment combinations for the new data. It's still going to be asterisk delimited, flat file. It'll still have its header and trailer similar. It's going to have some additional fields, a few. And then as soon as the documents are finalized there's going to be 2 documents, the EDI Roads V2 Specifications Guide, which talks about the file format itself and all the different fields, and then the companion EDI Data Dictionary that will have all of the detailed breakdown on the values that you can use for the fields, the options that you can pick, business rules that will apply to certain fields, like they're required or not required. If they are required, if this is selected. So all of that will be updated. I did want to say that we have reached out and we have been keeping in communication with the EHRs that have pinged us. So Credible, and give a shout out, Credible, CareLogic, Ocean, Epic, Dr. Cloud have all been very proactive. They've reached out to us. You all know who your peeps are with your EHRs. So they've been in the loop. We have been keeping them updated. Again, the documents haven't been done to where they're published, but they know kind of where we're at with those and where they're coming. So just to let you know, we have been keeping up to date with those and any others that have asked who may have like in-house IT departments and stuff. So if you've got any questions unique to your organization or something, I don't want to bring it up here, which is totally fine. Feel free to reach out to myself and our team, and we can set up whatever we need to chat with them. So with that, Kayla, let's see if others have questions. And I think folks can come off mute if you want to and speak, or you can use the chat.
Go ahead, Carrie. It looks like you're raising your hand if you do have a question.
It may have been answered in the chat, but I just don't see it. So a lot of, I'm sure everybody has this, but unknown answers. Will we have the ability to answer unknown? In, like, I know I can't remember what field it is right now. I think it's language or or interpreter, but maybe that's going away.
Interpreter is going away. So I don't know, Jody, is that a
affiliation? We can't answer unknown, I don't think. Maybe that's the one I'm thinking about. I know there's 1 or 2 where unknown is not an acceptable answer. And so we have to guess or put something in there that we feel because the client didn't answer it, right? So I'm just wondering if we'll have the option for unknown in more fields, if it's applicable that way.
Carrie, would it be possible for you to let us know what those fields are so that we could take an actual look at that a little closer?
I will sure do my best.
Yeah. And yeah, we know that the unknown, none, other, there are those throughout the fields to give you, some room to like at least submit what you have, capture what you can when as the client progresses. But we'd like to know if there's some that are impactful to all of you that are out there collecting this data and we don't have one of those elements, letting us know, then we can take it back to our business analysts and teams that can hopefully get Kayla and I an answer.
Perfect. Thank you.
Yeah.
It looks like Gina has been very attentive in the chat, so thank you, Gina.
It looks like there's a question in the chat from Shannon. I don't know if the team wants to take that.
Let me find it. For non-Medicaid service submissions associated with service elements, will they be able to be unsubmitted or canceled by EDI users if a client gets retroactive OHP canceling their use of service element dollars? Currently, there is a way to zero out a non-Medicaid service that was sent. So the non-Medicaid services, there is like a transaction, there's a flag in there. And if that adjustment flag is on, then it will take the zeroed out amounts that you have put in there. So there is a way to cancel them out. And I'd be happy to talk with your, your teams or your EHR or whoever, and we can see, if there needs to be some kind of modification or something.
Thanks, Jody, for answering that question. If there are no other questions, feel free to email Jody or I if they come up, or our Rhodes email. We've been getting more and more emails to that email address, which is great because that means folks are remembering that Rhodes is coming. So that's sorry, that's Jody again. Feel free to email Jody or I. We'll do our best to answer any questions that you have. Otherwise, I am really proud of us for getting folks out of here early. I will make a PDF copy of these slides, and I will put this recording, get it to our website and to our YouTube channel so that folks can share it if you have other people on your team that you think would benefit from this information. We also have one more EDI webinar this week. I'll also put a registration link to that webinar in the email I sent to folks. But other than that, thank you for spending a little time with us this afternoon. Oh, go ahead, Jody.
Yeah, just one quick thing. So there was a question that one of the folks here on the webinar saw that there's an involuntary services section, and will we be able to see the status of errors? So there's two places you're going to be able to see involuntary services for your clients. You'll be able to see it in the actual client summary area for successful submissions to include involuntary services. In the EDI tab, where you're working with your files and things like that, underneath those transactions, if one of those transactions is an involuntary services one and there were errors with it, it will list out what those errors are. It'll call them all out individually. So yes. When will we have more information about the behavioral health data warehouse? What information will we have access to? And Gina's answered that, since I read that out loud, Gina's answered that the data warehouse is kind of an internal tool for reporting, and that we're looking at what our options are for making public facing reporting. Kayla, are we going to them slides to this presentation?
Sorry, what did you say, Jody?
Somebody asked, where did they go to get slides for the meeting?
Yes, I'll make these slides a PDF document, and I will include it in an email I send to everyone who is here today. So that will be covered. So if there are no more questions, I think folks can be released. Have a great afternoon, and we look forward to working with you all soon.
Yes, thank you.
Bye, everyone.